Good day everyone, my name is Kate Angel Di Baluyat and I am a nursing student at Pamantasan ng Lungsod ng Marikina. And today, I will be performing the assessment on the thorax and the lungs. The examination of thorax and lungs are physical exam findings in relationship to a set of imaginary lines drawn around the thorax. Examination techniques used in inspection, palpation, percussion, and auscultation of the thorax. Advanced examination techniques used to evaluate pulmonary pathology. Respiratory assessment helps to determine the adequacy of respiration and enables the identification of changes to respiratory function. It contributes to the diagnosis and management of a variety of pathological conditions and helps the practitioner to evaluate therapeutic interventions.
Good day, Sir Gab. I am Kate and I will be assessing your lungs and thorax for today. So before that, I will sanitize my hands first to avoid the spread of different microorganisms. So I will examine you through the inspection, palpation, percussion, and auscultation. So before that, I will ask you several questions regarding your health. Okay. So do you experience any difficulty in breathing?
No.
Okay. Any chest pain?
No.
Okay. Any cough do you experience?
No.
Okay. So do you have any prior respiratory problems? Okay. So thoracic surgery? Okay. Allergies? None. Okay. So regarding your family history, do you have any family history of lung disease?
None.
Okay. Do you use cigarette or tobacco?
No.
No. Do you have occupation?
Yeah. No, I'm a student.
Okay. So, do you have any difficulty performing usual daily activities?
No.
So, do you take any medications for breathing?
No.
Okay. So, we will now start to inspect your thoracic and lungs. So, for inspecting your anterior and posterior thorax and lungs, can you inhale and exhale? So, we were looking for ulcerations, lesions, or any abnormalities regarding your thorax. So, as you can see, your anterior chest is normal and there are no abnormalities. Your shoulders are symmetrical and your back is normal as well. I also observed that when you breathe, you don't use your accessory muscles, so that is normal. In palpating your posterior and anterior thorax, can you please take off your shirt? So to palpate your posterior chest or thorax, we have to check for any tenderness and bulging of the skin in the skin. Okay, there are none, which is normal. Next one is I'm gonna put my palm without touching with my fingers, and can you please say 99?
99.
Okay, that's normal. And then gonna proceed to I will put my hands here. And can you inhale deeply, sir? Okay, exhale. So my thumbs separate simultaneously and equally, so it means that it is normal. Before we percuss the posterior part of your thorax, can you please place your hands across your chest? Okay. In percussing your posterior chest, okay, I will place my dominant hand and I will tap my fingers using my non-dominant hand, okay, to listen for any sound. The dull sound is located, so you have to mark that. Okay. So we're gonna palpate the other side of the posterior thorax. Okay. Gonna tap it again. Okay, so here is the dull sound located. So we're gonna mark that. So I'm gonna percuss again, but this time it would be on an upward manner. So this is where the dullness of the sound is located. The other one. This is where the dullness of the sound is located. And now we're going to measure those to see if the diaphragm of the patient is normal. Okay, it should be so the measurement of the diaphragm of the patient is 3 centimeters, which is normal. So for the last assessment for the posterior thorax, we have to auscultate the posterior part of the thorax using the diaphragm of the stethoscope. Would you please inhale when you feel that the diaphragm of the stethoscope touches your back? Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. So there are no abnormal sounds in the posterior part of the thorax. That is why we're going to move on with the anterior part of the thorax. Palpating the anterior part of the thorax of the patient, I will place the palmar surface of my hand to the chest of the patient and will instruct him to inhale and exhale. Okay, so inhale, exhale. For the other side, inhale, exhale. So as we can see, the breath sounds of the patient is normal in the second intercostal space. So, in percussing the anterior part of the thorax of the patient, I will place the palmar surface of my hand on the chest of the patient and will instruct him to say 99. Okay? Can you say 99, sir?
99.
Okay, another one.
99. 99.
Another one.
99. 99. 99.
Okay.
99. 99.
Okay, so as you can see, there are no abnormalities within the breath sounds of the patient, so it is normal. The last part, in assessing the anterior portion of the thorax, we will auscultate the patient using the diaphragm of the stethoscope. So I am going to instruct the patient to inhale and exhale to hear the breath sounds of the patient. Inhale, exhale, 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 last, inhale, and exhale. As I auscultate the patient, I didn't hear any abnormal sounds such as the stridors, wheezes, or crackles. So it means that the breath sounds of the patient is normal. So we document the necessary information, whether it is abnormal or normal findings. So that concludes the assessment for thoracic and lungs.